Should you get a COVID shot or not? Let's go right to the top to get some answers. With me is Dr. Jerry Larkin. He is director of the Rhode Island Department of Health. And Dr. Larkin, before I ask you about immunizations, as we head into the cold, flu, and COVID season, do you have any indications yet or predictions of how severe a year it's going to be?
For COVID, we always see a peak or a surge in late summer, and we'll see another surge later in the winter. So the summer surge has actually happened, and we're seeing a little bit of a decline now. We're waiting to see what will happen in December, January. Flu is much more difficult to predict, and it really has a lot to do with how well the vaccine available for this year is in terms of matching what circulating strains there are.
Let's get to the heart of the matter, because we're 5 years out from the pandemic, as you said, and many of the people that I've spoken with have become complacent, or they're getting mixed, conflicting information on, the effects of getting a COVID vaccination. So let me ask you something. What's your best advice?
COVID vaccines are very safe. That's been demonstrated time and time again. My best advice is that everyone who is eligible should get a COVID vaccination. So who does that include? Children from the ages of 6 months to 24 months should absolutely be immunized. They are at high risk of severe disease if they develop COVID. Anyone over the age of 19 should get a COVID vaccine booster in order to protect themselves as well as protect others. Between the ages of 2 years and 18 years, I align with the American Academy of Pediatrics, which recommends that it's something that should be discussed with a child's primary care provider to decide if it's right for them.
Well, you here at the Rhode Island Department of Health have issued an order to pharmacists that they can vaccinate people under the age of 65, and health insurers should cover the cost of that vaccine. Why did you feel it was necessary to take that action, to issue an order?
So in Rhode Island law, the pharmacist's scope of practice is defined by what the FDA licensing is. And for the FDA licensing, they said that vaccine was recommended for those over the age of 65, but it was a shared clinical decision making from the ages of 2 years to 65. What the standing order did was it allowed pharmacists to immunize people from the ages of 3 to 65, not necessarily according to the licensing of the FDA.
Right, because the Federal Food and Drug Administration was somewhat limiting the COVID vaccines to people 65 and over, or those who were immunocompromised.
Correct.
Is that right? Okay. So you gave a little pushback on this, not just Rhode Island, but also Connecticut, Massachusetts, several other states.
Yep.
But how will he push back on Health and Human Services Secretary Robert F. Kennedy's skepticism regarding vaccines? As you know from being from New England, the Kennedy name holds a lot of weight and sway here. Do you worry about that people might be listening more to his recommendations?
I worry about that they will listen to his recommendations because his recommendations are wrong and they're not grounded in science and they're not grounded in best medical practice. Whether or not he acquires some authority on account of his name, that's troubling if that's how people make medical decisions. Medical decisions should be made for a given individual in discussion with their primary care provider.
Are you worried at all about, in the climate that we have today, about retaliation? Because I understand federal funding provides 60% of the Rhode Island Health Department's budget. Does that ever come up for discussion?
So the actual percentage is about 50%. One always is concerned about what reaction any given action will provoke, no matter what it is. The important thing to understand is that public health is and should be apolitical. Everything we do is apolitical. It is only in the interest of the people of the state of Rhode Island, or in the case of the collaboration of the other states that have joined us in this work. I would hope that that would not inspire any kind of retaliation.
Well, Dr. Larkin, circling back to the coronavirus and immunizations, as your parting shot, what's your best advice again? Your best shot is get the shot?
Everybody should get the shot, yes. I will be getting the shot. I certainly immunize all my family. So yes, everyone should be vaccinated over the age of 6 months.
Thank you, Dr. Larkin, for this conversation.
Thank you.